TCT 2025 in San Francisco. The results of the Partner 3 trial, 7 years follow-up, have just been presented, and there was a lot of weight, a lot of interest around these results because, as you know, in the last European guidelines, the age threshold to perform TAVR instead of SAVR have been lowered, and so there was a lot of curiosity regarding these results, being the first core lab adjudicated data on 7 years durability of a TAVR valve compared with SAVR valve. And the presentation showed basically that at 7 years, like at 5 years, there was no difference in the primary outcome that was a composite of all-cause mortality, stroke, and rehospitalization that happened that was around 35% the occurrence of the primary endpoint in the two arms. And there was also a similar durability in both surgical and TAVR valves up to 7 years, and so the results are reassuring. It has to be said that they had a higher loss to follow up in patients in the surgical cohort, and the authors therefore performed a vital status sweep in order to be able to assess the mortality in a higher number of patients. The final number of patients that had a mortality assessment was around 92%, and on the other end, these made more complex to identify other clinical endpoints like stroke or thrombosis, because the status sweep could not be performed for these parameters. In the TAVR cohort, there was a higher occurrence of thrombosis compared to SAVR, and in SAVR there was a higher occurrence of atrial fibrillation. But again, these results may have been affected by disproportionate loss to follow-up in the surgical arm compared with the TAVR arm. Another very interesting finding was that the rate of biprosthetic valve failure was around 7% in both arms with no difference. And the authors also showed a very good valve performances both in the surgical and the TAVR arms up to 7 years. There was a slightly higher rate of PVLs in the TAVR arm, but these did not happen to affect survival and the composite endpoint at 7 years. So in conclusion, it was a reassuring trial that basically gave a lot of new information also on surgical valves with core lab adjudicated outcomes up to 7 years, and further confirmed that TAVR is a good solution in patients with symptomatic severe aortic stenosis compared with SAVR up to 7 years, and now we're waiting for the 10 years results in order to better understand what is the role of these two treatment options in the lifetime management of patients with aortic stenosis.